It actually involves doing a sleeve gastrectomy, which most people are familiar with, which is removal of most of the stomach, turning the stomach into a very long skinny tube, just about that big around. What that does is allows the patient to be satisfied on a very small portion of food, feel full very quickly, and stay satisfied for a long time. The duodenal switch takes the sleeve gastrectomy to another level by rearranging the small intestine just beyond the stomach. What that does is changes the absorption of nutrients. It adds a benefit for curing diabetes or improving diabetes, and it also increases the amount of time that patients tend to lose weight after the sleeve gastrectomy. For instance, a lot of people may lose most of their weight after surgery in the first year or so after the sleeve, whereas with the duodenal switch, they continue to lose weight for an even longer period of time, increasing the amount of eventual weight loss. So the duodenal switch that's being performed now in our practice is different than the older type of surgery. Dr. Carcamo and I, my partner, we chose initially not to offer the duodenal switch to our patients because of the high risk of complications related to nutritional deficiencies. There have been some new modifications to the technique, however, which have done away with some of those long-term nutritional problems, such as vitamin deficiencies, anemias, malnutrition, things of that sort. So with the new developments of the technique, the complication rates are lower, more of the intestine is available to absorb nutrients, and so the nutritional problems have been almost done away with. So now we are happy to offer this to our patients as a procedure that provides some of the greatest weight loss available, the greatest resolution of diabetes available within the operation, with a very safe complication profile. So the ideal candidate for the duodenal switch procedure would be a patient with a lot of weight to lose. For instance, somebody with 100, 150, maybe even 200 pounds to lose. Also a patient who's diabetic, because this operation really does do a better job in the resolution of diabetes than some of the other procedures. For instance, the gastric bypass touts a diabetes resolution in the 60 to 70% range, whereas 80 to 90% of diabetics after the duodenal switch can see a marked improvement or even a total remission of their diabetes. So the next step is to call our office for an appointment, to have a private consultation with either me or Dr. Carcamo in our office. We can review how much weight you have to lose, what your medical problems are, put all those things into perspective with regard to what surgery is best for you. If you have just a small amount of weight to lose, if you're relatively healthy, you may want a very low-risk procedure such as a gastric balloon or a lap band, whereas if you're already diabetic, you have more weight to lose, you may be more interested in a more involved procedure such as a sleeve gastrectomy, a gastric bypass, or even the duodenal switch.